Hi everybody, welcome to week 11. Hope you're having a good week so far. Okay, week 11. We have got pursued continuous quality improvement. This is an interesting topic for teachers. There's so many pieces of continuous quality improvement for teachers. Not only do you need to stay on top of everything in the clinical arena, you need to stay on top of the latest research and how to teach that and how to engage your students and get them to learn what you need them to learn. And so continuous quality improvement is challenging for instructors. So it's kind of nice. Let's say you teach the same thing for 3 semesters in a row and you've got your lecture piece down, which includes some give and take, question and answer. You've got your active learning strategies down. You've got some really good test questions. And it would be so easy to just say, hey, I'm going to teach this the next 2 semesters and I don't need to do anything. I'm going to do it exactly the same way because it worked. Well, we know what works with one group of students may not work with the next group of students. Each class has their own personality, and so we do need to make tweaks. We need to go back and evaluate. Did everything really work? Is there something that I need to tweak? Is there any new findings that have come out on these areas that I'm teaching? I think I might have mentioned before, when I'm teaching a topic, I pull out several different textbooks by different authors that cover that topic, and so I can see how it's presented. I go on the web and look for the most recent articles on nursing care of the patient with this condition, disease, whatever it is we're talking about, to see if there's anything new out there. And then I go on the websites for patients and healthcare providers caring for patients that have a particular thing, like American Cancer Society or something like that. And I go and I look at things like the latest research that's on their sites. They usually are listing out the clinical trials, so I can see what the up and coming is as far as trying to treat this, whatever it is. And so it really takes some effort to make sure that the information you're presenting is up to date. And especially if you're no longer doing clinicals, that makes it much, much harder. And you really have to dig even deeper to find out the latest information. The other thing is, we're not just educating students to work in the place that they're going to school. So you want to be careful that you're not just teaching local treatments and care, but that you're really looking broadly, so that students aren't totally taken aback when they look at other parts of the country that they may work and things are a little different. So continuous quality improvement is really significant. And it ties in with that lifelong learning piece. Improving your knowledge base on clinical, improving your knowledge base on teaching, they kind of go hand in hand. So pursuing continuous quality improvement. In order to teach students about continuous quality improvement, because we want them to be continually upgrading, right? I'm including an article about teaching students CQI, and it's a personal process that they go through in class and end up with a product about how to improve themselves. They're studying, gaining new knowledge, different things like that. So I'm attaching that. And then the test analysis paper is due this week. Yeah, it's hard to write test questions, really good one, isn't it? Yeah, it does take some time. And to really make sure that the right answer really is totally right and that the wrong answers really in some situations aren't right, it takes a lot of work to make a really good test. But I'm looking forward to reading those. Those particular papers take me a while to grade. Those are not quick ones because I try to give as much feedback as I can. So let's be safe and say I probably will not have them back until next Wednesday. I could be earlier, but let's count on Wednesday. Okay? All right, I think that's about it. I'm looking forward to talking with you about CQI. It's Very important to our profession that we're staying on that cutting edge. All right, everybody. See you in the main forum.